Welcome, Dr. Ian Rassel here from Corrective Spinal Care of California. This video is all about courses of care, understanding what is it that we do here. When someone comes in that's been injured, has suffering and pain, postural issues, overall their body's not working well, we get to the root of the problem, and we do so by having a thorough consultation where we can sit down and listen and hear exactly what you got going on, listen to your needs. Then, if necessary, we can do some specific examinations, particularly for you: posture, weight distribution, range of motion, orthopedic, chiropractic, and neurological tests. If needed, we'll take some standing digital x-rays from the front and from the side. That will all be on that first day. We'll send you home. We'll study and analyze all the information. The next visit, we can sit down and review your x-rays with you, review exactly what we found. If this is a chiropractic problem, we're going to show you exactly what we can do and have a plan tailored to your needs. I'm a visual person, so I want to explain and show what the course of care can look like. So imagine we all start off with our nervous system functioning at 100%, right? This is our born right and how we were designed. And over the course of years, whether there was trauma, whether there was poor posture, whether it was mental, emotional stressors, any number of things can affect the nerves. So eventually we're down here with our nervous system working 88%. I just asked a patient yesterday, his wife had debilitating headaches. She was down at 68%, and I asked him, what do we want her at? And he says 102%. And it made me smile because we should all want that for our loved ones. Unfortunately, we're not going to be able to get her at 102%, but 100% nerve function was definitely possible. Now, the beginning phase of care, the first few weeks, we call this initial intensive care. The whole focus of this phase is to calm down the inflammation. In your world, you're going to call it, help me with the discomfort. Let's ease some of this pain. Now, every patient can be different. Not all patients are going to be completely out of pain within a couple weeks. But we do know that this beginning phase of care, we're going to see changes. We're going to see less inflammation. Statistically, most men, when we get here, we all do the same thing. Thank you very much, Doc. I'm going to go back to my barbells and jackhammering. No. The wives usually drag them back in and say, honey, we got to get this problem fixed. And they're right. This next phase of care is called corrective remodeling and strengthening. Depending on how long the problem's been here, this could be weeks to months, maybe even years. Every month, we're going to re-examine to chart your progress. So not just feeling better, but just as important and more importantly, we're seeing changes mechanically. Eventually, we'll get you to a time where you're as good as we're going to get you, and at that stage, we re-x-ray. So we take a new set of x-rays here. We'll then sit down and compare the new x-rays to the first x-rays, and hopefully we can end corrective care. This is oftentimes we see tears, high fives, and hugs. Do a little dance. We've gotten mom as good as we can get her. We got our teenage daughter's scoliosis stable enough so she can avoid braces and surgery. At this stage, 97 times out of 100 patients, when they get up into this range, they say the exact same thing. They say, Doc, I didn't know how bad I was until I started feeling this good, and I definitely don't want to go back down. So what can I do to stay here? And this is what's called maintenance care, where you're checked from time to time so you don't go back down. If you or someone you know has tried over and over different ways to help with their suffering, whether it be through medications, whether it be through physical therapy and chiropractic, and we're just not seeing the results, please reach out to us at Corrective Spinal Care of California and let's see if we can help you.